Hello. There are many diseases that have several causes. Shingles, as colloquially known, is one of them. Many years ago, doctors did not know what caused it or how to treat it. Therefore, people flocked to popular prawns and healers. But at present, it's already known what causes this disease and how it should be treated. Do you also want to know? Shingles is a rash or blistering of the skin. It's caused by the varicella zoster virus, which causes chickenpox. After having chickenpox, the virus remains in your body. It may not cause problems for many years, but as the virus ages, it can reappear as shingles. Shingles is not contagious, but someone with shingles can spread chickenpox. If you've never had chickenpox or had a chickenpox vaccine, try to stay away from someone who has shingles. If you have shingles, try to avoid approaching those who have not had chickenpox or have not had the chickenpox vaccine, or anyone who may have a weak immune system. Anyone who has had chickenpox is at risk of shingles, but this risk increases as you get older. Shingles is more common in people over age 50. People with weak immune systems are at a higher risk of having shingles. This includes those who have had immune system diseases such as HIV and AIDS, have certain types of cancer, take immunosuppressive medications after an organ transplant, or your immune system may be weakened when you have an infection or are stressed. This may increase your risk of shingles. It's rare to have shingles more than once, but it can happen. The first signs of shingles includes burning or stinging pain and tingling or itching. In general, it appears on one side of the body or face. The pain can be mild to severe. Between 1 to 14 days later, you'll have a rash. This consists of blisters that generally last between 7 and 10 days. The rash usually occurs in a single band around the left or right side of the body. In other cases, the rash occurs on one side of the face. Rarely, usually in people with weakened immune systems, the rash may be more widespread and resemble a chickenpox rash. Some people may have other symptoms, such as fever, headache, shaking chills, and abdominal pain. Shingles can cause complications such as postherpetic neuralgia. It's the most common complication of shingles. It causes severe pain in the areas where the shingles erupted. In general, it improves in a few weeks or months, but some people may have pain from postherpetic neuralgia for many years and may interfere with daily life. If shingles affects your eye, you may have a vision loss. It can be temporary or permanent. Hearing or balance problems. They're possible if you have shingles in or near your ear. You may also have muscle weakness on that side of the face. These problems may be temporary or permanent. Very rarely, shingles can also cause pneumonia, inflammation of the brain, which is encephalitis, or death. In general, your healthcare provider can diagnose shingles by looking at your medical history and observing the rash. In some cases, you can take a sample of the tissue from the rash or the fluid from the blisters and send it to a laboratory for analysis. There is no cure for shingles. Antiviral medications can help make the outbreak shorter and less severe. They can also prevent postherpetic neuralgia. Medications are more effective if you can take them within 3 days of the onset of the rash. Therefore, if you think you might have shingles, talk to your healthcare provider as soon as possible. Pain relievers can also help with pain. A cold towel, calamine lotion, and oatmeal baths can help relieve some of the itching. There are vaccines to prevent shingles or lessen its effects. The Centers for Disease Control and Prevention, CDC, recommends that healthy adults 50 years of age or older receive the Shingrix vaccine. You need 2 doses of the vaccine, separated between 2 to 6 months. Another vaccine, Zostavax, can be used in certain cases. Thanks for watching. Please like and share the video in social networks. We'll be right back to you as fast as we can.